remember the whole day, I just remember just pretty much just staring at him, really. Either holding him or staring at him in his little cot. But yeah, it was really bizarre. And when I started getting feeling back in my legs, that's when you start to feel a bit of pain. It's not too bad, but it does start to sting down there. But again, because you're in like a little baby bubble, it's almost like you can't really feel it. Yeah, so my mum and dad came around first. Now, on the ward, I forgot to say this, but it was so hot, like boiling, sweating, horrible and hot. The room was quite small, four other patients in there. It was very cramped, very stuffy. It was pretty hideous, not gonna lie. So when my parents turned up, they didn't actually stay too long because they couldn't stand the heat. Mum felt faint. But before they came along, that was one of the things I said to Dad. I was like, please, can you bring a fan? Like, it was unbearably hot. And I just obviously had surgery. I was sweating. It just wasn't nice. That's the only thing I would say that I really struggled with, was the heat in there. And then Jay's mum and dad came with Bronte, bless her. So I hadn't actually cried at this point. Like, there was a moment when I first saw him and they lifted him up, I could have cried. But I think because I was still like a bit out of it, it just didn't happen. Like, just nothing came out. And now Bronte, bless her, she was the first and the only one so far who got really emotional, and it proper set me off. Look, so he's setting me off now. So yeah, Bronte was the first and the only one to have got emotional, and she ended up setting me off because she kept saying to me, she was like, what, you've not cried yet? And I was like, no. I was like, I don't think I've taken it in yet. And then Jay went off to find some food. Bronte stayed with me for a bit. And yeah, and then the rest is a blur. And not long after they went home, the midwives came round and basically encouraged me to get out of bed, to have my shower. So bearing in mind, this is literally like maybe 5-6 hours after surgery. I was managing to get up. It was painful, and it did take a lot to get out of bed, like just to shuffle a bit more to the edge of the bed, put your feet down, bring yourself to stand up. Jay had to then come in and help me in the shower. I was given like a chair in the shower to sit down, but oh my god, the shower literally is the best thing after that, especially when you're sweating as well. It was really nice. I had like a really nice cold one. It just felt nice, you know. Spent most of the night awake. Jay was conked out. He wanted to be fed a few times in the night as well. And I did kind of like have a little bit of sleep here and there, but like literally like the smallest nana naps. I'm talking like 10-15 minutes here and there. And then morning came and they were pretty much ready to discharge me, really. I didn't expect to go home so soon. But yeah, I think it was maybe about 1:30, they were happy to discharge me. They had like all the different people come round and do his checks and stuff. Midwives come round and talk to us about different things. I was given fragmin injections, which I'm still taking now, just to reduce any sort of blood clots that might happen, because you're more prone to it once you've had a C-section. Even did like a hearing test on him. He passed that. Oh, the doctor came along to do like, it was like a head to toe assessment, basically, where they go through everything just to make sure everything's all right with him. So he took him into another room and Jay went with him. And then Jay came running back and he was like, I need a nappy. He's pooed like all over the doctor. And I was like, oh my god. So that was quite funny. So he's basically weed on a surgeon and then pooed on a doctor. Because he was in breech position, he's got to go for an MRI in a few weeks to see, because they can get hip problems. They just need to check his hips. Yeah, shortly after that, we were ready to go, but it was just because it was just me and Jay. Jay had to do a bit of a relay, taking all the bags down to the car and stuff. I knew I wouldn't be able to walk all that way, so we got a wheelchair to wheel me. But in between sort of getting that all organised, Squid wanted about 3 feeds, so we didn't actually leave the hospital until about 3:30 maybe in the end. It took about and then yeah, coming home was just with like this little bundle of joy. Was just, yeah, it's crazy. And it's been a week already. A week. I still can't get over it. It only feels like yesterday. Yeah, the difference in like those few days. I'm up and about now. Still a bit ouchy. It's not that sore though. I can go up and down the stairs. I can even lower myself onto the toilet and get myself out of bed. Sometimes after I've had a sleep in bed, I do need Jade just to help sit me up, because sometimes that can still hurt a bit. But otherwise, yeah, it's crazy how quickly your body like recovers. So yeah, we had like the family round again on the day that we got back. So had my sister, my mum and dad, Jay's parents and Bronte all came over. I was knackered, but I knew I wasn't gonna be asleep. I was still buzzing. We've named him Taylor, by the way. So first name Taylor, which is my surname, because I want to continue the Taylor name, as there isn't really anyone in our family that's going to go on and carry the name. His middle name is Andrew, which is a tradition on Jay's side, on the Danish side. His granddad or someone decided that the firstborn and I think the thirdborn was going to be, no, the firstborn girl and boy was going to continue the name onwards, basically. So there's quite a few of them, but yeah, we chose Andrew. So he's Taylor Andrew Quist.